it was very hard to educate patients that what I do is extremely valuable, is not in any way tricky, and it's the way that patients were educated to get services and to polish that kind of language to what you say to the patient, what you convey to the patient. It's very hard. Once the patients come to us, and I'm talking us about specialists that are doing direct care, they understand probably after the first visit that the value that we offer and the care that we offer is excellent, and we really give everything that we are supposed to give because we are not stressed by the environment. We are not constantly looking at the computer, and we don't have 30 patients waiting at the door to be
And
seen.
yeah, you can spend the time with the patients that they deserve. And then also the transparency of what is being paid is right there. And then on top of that, like when you're paying for a service as a patient and as a provider, when it's transparent like that, the incentive is to make sure and add value to kind of like, you want to be able to make it worth more than they're paying as a physician. And also the patient is worried about that too. They're like, Is this worth my money?" And so that's healthy, I think, incentive that gets created in that sort of environment versus in the traditional healthcare system, like nobody knows what anybody's paying. It's just like monopoly money in some ways. And that doesn't drive any of that incentive, but it is difficult, I imagine, because you have to reshape people's belief system or like people are not used to that as the way things work.
That's very true. Patients are, and again, I don't want to use words that will be offensive to anyone, but I feel like in the current system that we live, we are brainwashed altogether, patients and physicians, to work a certain way and to reach out to get care a certain way. And when you bring something different, like every product that is different from what you are used to use every day, it takes time. But the fact that you provide the highest quality of care, that is turning back in 10 times, I would say. And the satisfaction that you have as a physician to really spend the time with the patients and see the outcome of these patients. You really have the time to see how patients are improving, and you have time to listen to them. And that's the other thing. I think that we are not only with one hand, we put orders, and with the other hand, we hand a prescription. We are healing patients. And it's extremely important for the patient to build up trust. Patients do feel like the system betrayed them. And by saying the system, they only see us. The system is us. We are the face of the system. Unfortunately, when they think about medical care, they think about their doctors. They don't think about anybody else besides us, because the main interaction that they have with the system is their physician. So how are they going to know who to blame? They're going to blame us for things that they're not happy. And rebuilding that kind of trust is extremely important for both sides.